If you've been suffering with anxiety or depression, you may be a person who has gone through several iterations of different medications through your lifetime trying to control these symptoms. The important thing to realize is that there are always underlying correctable causes that contribute to these conditions. For example, there's 5 areas that we try to optimize to correct these conditions. The first area is going to be hormones. The hormones that are most connected to anxiety include progesterone in women and testosterone in men. Both of these levels start to fall to under 50% by the age of late 30s, and this is when most women and men experience either anxiety or worrying about things they didn't worry about before, or even frank panic attacks. The second hormones that are responsible for depression include thyroid. Thyroid fluctuations start somewhere in the 20s. By the 30s, these fluctuations may contribute to depression. Even if you're in the normal range, you may not be in the optimal range. Nutrients are the second area that is responsible for anxiety and depression. The 2 most important nutrients in this area include omega-3s, which come from fish oil. Many studies in the psychiatric literature are showing a 30 to 40% decline in both anxiety and depression with omega-3 intake of above 2.5 grams. We also know that the level of magnesium in the body is critically important for anxiety, and B vitamins, which are critical for depression. The third area is going to be the toxicities. The major toxicity that is affecting our mood is going to be the electromagnetic waves in the air that are coming from cell phones and Wi-Fi's and computer screens. The fourth area is going to be the state of our mind. The more stress we're under, the more chance that we're going to have a decline in either hormones or nutrition. We know that simple things like the amount of serotonin that is produced by the bowel controls the level of our mood. Serotonin is mostly made in the bowel. If the bowel isn't functioning well, you're not making enough serotonin. In fact, most of the drugs that are aimed at depression are aimed at increasing your serotonin levels. The fifth area is the state of the body and how much pain you're in or not. So obviously, if the body is in a state of pain, you cannot achieve an optimal mood. When you're looking to address anxiety and depression, it's important to address the underlying causes in these 5 areas that contribute to this condition.